I'm Dr. Jane Levesque, and this is the Natural Fertility with Dr. Jane podcast, where we help couples uncover the real reasons behind their fertility struggles. The quick disclaimer that I have to give you is that nothing in this episode is personal medicine advice. I'm going to share how we support couples through IVF in my practice, the phases we use and what we focus on in each phase, but your medications and supplement decisions have to be made with your own fertility team. So today I want to walk you through the 6 phases we use for IVF support, from pre-IVF prep to that positive pregnancy test, how long each phase lasts, and what's actually helpful to remember in each phase so you're not guessing or throwing random supplements at your cycle. Here's why I want to share this. I see so many couples going through IVF blindly, and the women tend to carry more of the blame once the cycle fails. They feel like their body has failed them. Just because IVF failed does not mean that your body is broken. It usually means you didn't get the right help at the right time. IVF is a tool, it's not a plan. And your results depend hugely on what you do before, during, and after the cycle. So here's the problem that I'm seeing in the fertility space right now. You're about to start IVF. You've maybe already done 1 to 3 rounds and you're just feeling anxious, overwhelmed. You have dissociated from your body. If you've done multiple rounds, you're probably exhausted. You don't want to waste any more money or time, and you wish that there was more that you could do to support yourself. And your fertility doctor is probably telling you there is nothing you can do to support yourself. There is no research or studies showing that there is a supplement out there that's going to improve your fertility outcomes. And that's not entirely true. You also might be taking prenatals or maybe ubiquinol. Maybe you have heard about some IVF detoxes, but you're really confused about timing, when to push, when to back off, what to stop, and what to keep. And here's what most people think and do. They treat IVF as a single event. You start the meds, you do the retrieval, you do the transfer, and then you hope that things are going to work out. But most people will stop at supplements, except maybe a prenatal and vitamin D and a ubiquinol. That's my hope, at least anyways. But most people don't even do any supplements because they're just feeling really overwhelmed. Most functional practitioners don't know about IVF enough because they're not specializing in fertility, and they don't really understand the process and the interactions. So they tend to back off during this time. So then you're also feeling overwhelmed because, let's be honest, how many freaking needles on you and other things you need to remember? It's a lot. So there's no real recovery phase after a failed or a canceled cycle. You just kind of jump into the next cycle, or you take a break because you feel physically unwell, you feel emotionally drained or financially drained. So it doesn't work, because the first thing that you need to know before going into IVF is, why can't you get pregnant in the first place? We want to give you time to prep before IVF, and then we want to do a good detox before we conceive, period. I think most women need a really good detox before they conceive, unless they have already done a bunch of detoxing. We want to retest prior to doing IVF to make sure that is in fact, the next step in your journey. And then we want to have a structured protocol throughout IVF based on your own individual needs. So we have these 6 distinct phases in terms of how we write the protocol, and I want to share them with you because each of the phase has a different job. We have the pre-IVF prep, which is also trying to conceive naturally phase. We have stimulation, 2 days pre-collection. 4 is post-collection but pre-transfer. Stage 5 is post-transfer, and then stage 6 is early pregnancy. So each phase has a rough time window, specific support that helps, and then things that we must stop. So here's the general kind of principle. The phase 1 is going to be detoxing and then building and repairing and optimizing those nutrients. Phase 2, 3, and 5 is really protect, don't poke. We don't want to stimulate anything. We just want to protect what we have built and continue to optimize. Phase 4 is really about gently resetting and recovering. This is once we've done post-collection but pre-transfer. And then phase 6 is what got you pregnant keeps you pregnant. So let me go through each phase. Phase 1, the pre-IVF, try naturally. This phase is usually 4 to 6 months for most couples. Some will need to go up to as high as 12. And that really depends on why you're not getting pregnant in the first place. I'm a big believer in understanding the why. Why are you not getting pregnant? Pregnancy is a natural process. If it's not happening, something is missing. We want to assess both partners. And the goal of this phase is really to transform your terrain before meds ever touch your body. We want to optimize your metabolism. We want to optimize your liver function, your gut function, and your nutrients. Someone who is metabolically healthy and has optimal nutrients will need far less medications than someone who isn't. And I see it in practice again and again. And I'll talk about some of the stimulation components in a second, how we need to consult and think about IVF when we are metabolically healthy. So this is when we really focus on tightening your fundamentals, whether that's the sleep, the circadian rhythm, the blood sugar, the stress, and the nervous system regulation. We really do think about correcting your deficiencies, iron and ferritin, vitamin D, B12, folate, zinc, insulin, inflammation, thyroid, all of those things we need to look at and optimize. We want to load your mitochondria and antioxidants for egg and sperm quality. This is something that has to happen minimum for 3 months. But if you have premature ovarian insufficiency or diminished ovarian reserve, sometimes we need 6, 9, 12 months, depending on the development of that follicle and how the body is responding. We need to address the gut, the vaginal, and the seminal microbiome and make sure that there is no hidden infections. This is also where we support, whether it's therapy, breath work, vagus nerve work. It's really getting the system out of the survival mode and getting you into that rest and digest and safety before we add this intense procedure. Because IVF is intense, you guys. This is why most women have to numb themselves going through it, because there's a lot that's happening. So that phase lasts anywhere between 4 to 6 months, but for some it's 12. The stimulation phase 2 is roughly 10 to 14 days. And the goal here is to really just support your energy and stability. We do not want to interfere with the meds. The work has been done. The microbiome has been shifted. The nutrients are optimized. We're just kind of keeping the wheel steady. So clinically, we want to have multiple follicles grow. We want to have 4 to 6 monitoring visits. You're watching for estrogen, the LH, the progesterone, the lining, and you're watching for the ovarian hyperstimulation syndrome. Again, this is when I have women who are metabolically healthy and have optimal nutrients. Even if they're over the age of 40, they need a lot less drugs. And there's multiple patients that I have taken through IVF who've had really great egg retrievals, and the doctors have always been shocked of how little meds they needed in order to get the results and to get really good results. And that is because we did the work beforehand. The focus for you while you're going through stimulation is to really keep the nervous system as regulated as possible. Light movement, breath work, setting boundaries, saying no to things, not overloading your plate, maintaining established supportive supplements that are safe in this window. We personalize all of these for our clients. And you want to make sure you're not adding anything new to the protocols, no detoxes, no intense exercises, no saunas, no experimental herbs. The way that I want you to think about this is nothing new on race day. I'm not sure if you're familiar with that saying, but my husband ran, a bunch of marathons and ultra marathons, and this is a really common saying in the competition world. Nothing new on race day or nothing new on competition day. You want to make sure that the system is just steady. Even if something sounds sexy, we do not introduce it unless we know how the system is going to respond. The big thing through stimulation is really we are looking for the ovarian hyperstimulation syndrome. I can't tell you how many of my women, after 5 years of struggling with infertility, and then we go through their IVF numbers and the symptoms that they tell me with the bloating and the pain and how long it took them to recover, that they were essentially overstimulated and not properly treated after. So something to watch out for. Phase 3 is the 48 hours before collection. So really the goal, we're just stripping down everything, to be honest, to make sure that the procedure goes really smoothly. So we do really good protein and electrolytes and whatever the clinic has prescribed in terms of medications, but we really let the body just focus because we don't want to have any blood thinning supplements. We definitely don't want to have any detox agents, no castor oil packs, no heat, nothing that's going to contribute to that overstimulation. We want things to be just calm and ready for the anesthesia, for the retrieval, and making sure that there's no issues with clotting. Phase 4 is post-collection but pre-transfer. Now this phase can be 5 days or it can be 1 to 3 months if we are doing a frozen transfer versus a fresh transfer. Now it's highly dependent on the woman and how the stimulation phase goes. It also depends on her uterine lining and symptoms and estrogen rise, LH, progesterone. Again, everything is case by case. By the time our women in our practice get to this, we really know them, and we can, I don't want to say we can almost predict, but we can almost predict if it's going to be better to do a fresh transfer versus frozen. And the goal during this phase is to really just recover from the stimulation, gently clear meds, and then get ready for that transfer. So if the fresh transfer is in just 5 days, this is just really gentle recovery plus stability. There's not a heavy detox section because it's only 5 days, but you just want to help the body clear the drugs and the estrogen and come back to normal. And when I say that come back to normal is when women come to us and they have a lot of stuff going on with them and really high levels of inflammation, and we get all of that down, and then they go into IVF and they get stimulated, they can feel that their system is overloaded. They can feel that estrogen is much higher than they've ever had it. They can feel that the drugs have side effects. So we just want to help the body clear some of that load. If we're doing the freeze, then you might have a few months. And again, it depends on the woman. My recommendation is you should feel like yourself again before going into transfer. You should feel good and your numbers should look good. So we essentially bring back the detox support, whether that's liver, fiber, sweating, castor oil packs, estrogen detox. So things to just help clear that excess estrogen out. It depends on the woman, how high the estrogen went, and then it depends on her genetics and her ability to process that excess estrogen. We want to rebuild the gut microbiome, and sometimes we'll recheck the labs, in whether that's iron or B12 or vitamin D or just inflammation level and liver enzymes. We'll take a look to make sure that everything looks good in that 1 to 3 month period, and we make sure we load up on the mitochondria support and the lining, so the uterine lining, so then we're ready for that transfer. Phase 5 is post-transfer, which is in the luteal phase, and really that's from transfer to pregnancy. So it's 7 days, and I'll tell you that most of the phase 5 and phase 6 are very similar, just slightly different goals. Phase 5 is we just want to hold the environment steady and support implantation. So absolutely zero experiments, whatever we supported you into transfer stays. There's no new supplements, and we also try not to rip anything away because the body is used to it. Doing a lot of nervous system support, rest, gentle walking, stress management. We, of course, usually most women on IVF have some kind of progesterone support that they're on. Some will have estrogen support, so we need to talk about, is that necessary? What's happening with the uterine lining? What's happening with your system? What kind of progesterone do you need? What are your levels of progesterone? Do you need vaginal? Do you need oral? Are we seeing the response that we want to see, basically? And what I will say is there's a lot of clinics out there that do not actually test, which is bananas. They just put you on progesterone and say, well, we got you on progesterone and we hope that's enough. You should be looking at the levels because that tells us a lot about how your system is handling, and also your level of anxiety will be different when you have higher levels of progesterone versus lower levels of progesterone. And progesterone is really, really important. So we want to make sure we're not just guessing. So this is something that will actually just guide our patients. We're not prescribing, but we'll guide them based on the testing. And, a lot of the times we will test because the clinics won't, which is a little bit embarrassing if you ask me. Mentally, this is probably one of the toughest phases because you want to make sure you don't make a mistake. You want to do everything that you can. And your job is actually to do nothing. It's the sit and hurry up and wait period, and to rest as much as we can and just let the body do its thing, which is why in the first phase, we practice the meditation, the stress management, the vagus nerve stimulation. When we get into phase 5, we're not freaking out. we actually know how to regulate our nervous system. It's still difficult, but we know how to do it. Phase 6 is early pregnancy. So from positive tests throughout at least the end of the first trimester, what got you pregnant keeps you pregnant. That's really important. As soon as you find out that you are pregnant, you want to check HCG and progesterone levels. Then you repeat the HCG 48 to 72 hours later, and then adjust progesterone needs if needed. And then we adjust our protocol based on symptoms and what we know in the labs. So my preference is to have a good lab panel on you a month before we start trying to conceive, or a month or two before we go into IVF, so then we know where the thyroid is, we know where the inflammation is, the nutrients are, and then essentially we don't tend to test until later into the first trimester to make sure that things are good. Again, everyone is different. If you have thyroid issues, I tend to test a lot more frequently. If that progesterone is low, if the immune system is not responding the way that it should, then we of course test more frequently, but just general rule of thumb, you don't need to test after you get that initial HCG 72 hours later, and things are good. Now we just need to let the body do what it's designed to do. And you're not going to get off progesterone till we confirm that the placenta has taken over and that you have good levels of progesterone. So for some, the placenta takes over 10 to 12 weeks. For others, it's 16 to 18 weeks. We just have to test and look. You shouldn't be getting off progesterone just because you're past that first trimester. You should make sure that those levels are in fact where they need to be. So, just to give you guys kind of a quick example, the way I've had a couple of couples recently, which is why I'm recording this podcast, because I think it would be really relevant for you. But we have this couple, they were fairly young, but we did, 12, 16 months of prep. He had ulcerative colitis. She has this kind of hypothalamic amenorrhea picture, but not quite diagnosed. And because it's not that severe and she's doing a lot of work, we decreased the inflammation. He's retesting his sperm analysis one more time, but we've seen tremendous improvements over the last 16 months, especially as his ulcerative colitis has basically been completely reversed. But, after doing some retesting, we just see that her follicles are not naturally responding to her brain signals. So IUI is probably not going to work. So we need to do a little bit of a stronger stimulation, which is IVF. And she's already done all the work. They've already done 16 months of pre-work. All we now have to do is just support them through that IVF cycle. And another couple, she's 45, and I would have loved to have her go into IVF after 6 months of prep. But there's a lot of stuff that came up for them, and they needed time to work through them. So sometimes I'd love to see it happen in 6 months. And for them, it was also around 16 months until we're doing IVF literally in the next couple of weeks. So that pre-phase, we don't know how long it's going to last, but we need to work with the couple. And then once you go into the stimulation, you just want to make sure, and I give all of my patients handouts, all of us clinicians do, to make sure you guys know what questions to ask and you feel empowered going through the process. Because here's my recap for you. IVF is a big event. If we break it down into these 6 phases, when you know what each phase is for, you kind of stop guessing and you start supporting your body in the right way at the right time. You actually feel empowered going through this process versus this is just something that's being done to you. We need the transformation before. We use the phase 1 to actually change your health and fertility, not just to go, IVF is the next step because you've tried for this long and you've tried a couple of supplements and diet lifestyle changes and nothing happened. You need an actual transformation. Now, stability during the phase 2, 3, and 5 are about protecting what we've worked on and just stabilizing it. So we're not detoxing, we're not poking, we're not doing any new experiments. And then the recovery and the continuity, so that phase 4, post-retrieval, pre-transfer, and phase 6, which is post-transfer, we actually just recover. We make sure that the body is ready for the transfer, and we get ready for that early pregnancy. So again, all of this is educational. It's what we see and how we support couples in our clinic. So your specific medications and supplement choices always need to be made with your fertility team. And if you are preparing for IVF, you're in between cycles or recovering from a failed one, and you want a structured plan for these 6 phases for both you and your partner, go ahead and click the link down below and apply to work with us. If we can help, we'll show you what that looks like. I hope you guys found this helpful, and I want to set this new standard in how we actually approach fertility from the conventional side and the natural side. There's a lot that we can do to optimize before we go into IVF, and we do not need to have multiple rounds in order to just get a couple of embryos to then, maybe have a baby. I think there's a lot more strategic planning and a lot more control that you can have, but it means we actually need to take time on the front end instead of jumping into solutions blindly, even if it's covered by insurance. Just because you're not paying for it financially doesn't mean that there isn't a cost to this, physically, mentally, emotionally, long-term health, all of those things. So we need to start thinking about these procedures because, like I said, IVF is really, really big. And most of us are walking into it completely blind, hoping that it works. So I hope you guys found this episode helpful. Thank you so much for being here, and I'll see you next time.